today's topic is, I mean, mostly IPF or idiopathic pulmonary fibrosis. So I wanted to give you like a sort of a free rein to tell us a little bit about your experience. So not like textbook stuff, but your own experience with IPF patients. Do they all get treatment, or are some of them just followed? What drugs do they commonly, yeah, like what is the current treatment for IPF patients? And then when they're treated, what is the eventual outcome in your experience? What happens with them eventually? Can you give us some sense of that? Because the audience here is mainly pathologists. So give us some sense of IPF.
Yeah, I think that probably the most important thing is to sort of talk about the journey that the patient goes on, right? Because um, the symptoms for IPF are so non-specific, right?
Right.
Everyone's got shortness of breath and cough, and that's not specific, let alone to IPF, but any pulmonary disease and so many diseases in general causing shortness of breath and cough. And so it takes often a long time on the order of even a few years to get a diagnosis of IPF. And I think over the course of that time, the patients get, frustrated. They're not getting answers they want. And so one of the things that we really try to spread the word on is sort of shortening that time to diagnosis, to really get people to their diagnosis sooner. And I think that's sort of an underappreciated aspect of the disease. And that's true for all ILDs, not just IPF. When they come to clinic, especially on that first visit, they're usually like sort of two phenotypes that I see. One is the person that like knows exactly what they have. They've done all the online research. They know, the prognosis, the treatment options. What are we going to do about it? They ask all the important questions, transplant, things like that. Unfortunately, I think more often than not, the other type of patient I see is the one who kind of comes in as like the doctor told me there's something on my CAT scan. They don't really know what it is, or they couldn't really explain what it is. And then I have a conversation where I sort of like hit him over the head with a two by four, right? When I give him this diagnosis and prognosis and sort of the
Mhm.
natural history of it all. And so I think that journey is really underappreciated, as I said, and it really can take a toll on the patient and their families.
Yeah.
When it comes to treatment, yeah, I mean, the I personally don't treat everyone. However, I do offer treatment to everyone, right? So when you're talking about a progressive disease with a bad prognosis that we may or may not talk about more later, I think you're obligated to discuss treatment with everyone.
Yeah.
The problem is the treatments we have aren't great, right? And so how hard you sort of push them for treatment is based on a variety of factors with regards to lifestyle, how bad their disease is, all that kind of stuff. And so that's a pretty nuanced discussion that we can have if you want. But
Yeah, because it's surprising to me, Les, that some patients are not treated for whatever reason. So if you don't treat with let's say with an antifibrotic, then
yeah,
what are their other options? Do they just say, no, I don't want any treatment? What happens with those patients?
yeah, I mean, some patients don't want treatment. I mean, the treatments are expensive.
Hmm.
They have a fair amount of side effects. And sometimes I used to liken the treatments to chemo to a degree because like you have a potentially really bad disease, right? And the treatments have toxicity. The problem is with chemo for the most part, like you're getting like defined treatment, cycles, right? But with antifibrotics, like you're on them forever. If you're tolerating them, if you're able to, and sort of there's no end point. And so they there's cost associated with them, which can be quite burdensome on the patients. And so not everyone really wants to be treated. The other thing is like the these medications, it's all about setting up expectations with the patients, right? So these medications don't make you better, right? In a perfect world, you take a blood pressure pill, it makes your blood pressure go down, right? Um, these meds don't make you better. They don't reverse any of the scarring, any scar that's there. stays there, and they're not even perfect in that they totally halt disease progression, right? They slow disease progression, and so the benefit is really hard to measure. There is a benefit. I'm not questioning the data, but it's hard to measure that. You never know what the road not treated is. I mean, the road not taken is.
Yeah.
And so there's some patients that we diagnose them and it doesn't seem like their disease is progressing rapidly, if at all. And so to put someone on a medication when the effect is sort of difficult to measure
Yeah.
opens them up to potential side effects, and the benefit is sort of questionable at that point.
Yeah. Yeah.
It's like, do you put someone on a medication to slow something down that's moving at the pace of a turtle?
Yeah.
Is that worth it or not?
Yeah.
Alternatively, you've got also the people that have, end stage lung disease and sort of the horse is out of the barn there, right? Like you can't get it back in and they may be just too severe that opening them up to that risk isn't worth it. What if
Yeah.
they're too short of breath to make it to the bathroom if they have side effects, things like that?
Yeah. Yeah. No, that's very helpful to know, Les.